Okay, let's jump right in. This is a quick webinar about the healthcare option that CAR has recently made available to Colorado Realtors and affiliates. I usually start by talking about eligibility, who can use this program. So clearly realtors can in the state of Colorado. Their spouses and dependent children can also use this. This will probably be a little more clear later, but the realtor, him or herself, does not have to be on this program for the spouses and or dependent children to take advantage of it. So if for some reason this plan doesn't work for the realtor, the family of the realtor can still enroll and use the different benefits, which we're going to talk about in a bit. Realtor assistants and staff may also use this. Realtor affiliates, so affiliates of CAR at the state level or any of the local associations. So we're talking specifically with the Vail board today, but this is true of other local associations as well. If there are affiliate members, think like appraisers, independent contractors, inspectors, um, independent loan officers, people like that may also use this as long as they are members of the local board or the CAR at the state level, the CAR Association. And then lastly, there is no open enrollment period. We are in the middle of open enrollment nationally for traditional insurance programs. So this is on a lot of people's mind right now because they have to either renew what they were doing before, or if they want to change their traditional insurance, they do that this time of year. But this particular solution does not require open enrollment. You can enroll in this plan any month of the year, as long as you do your enrollment, your online enrollment by the 20th of the previous month. So as long as you enroll, say by December 20th of this month, your start date would begin on January 1st. But if you wanted to start February 1st instead, for some reason, you could enroll by January 20th to make sure that that's done. And that's true about any month of the year. Okay, one of the big reasons that CAR wanted to make this available is just to provide some sort of cost savings for realtors. Medical insurance, the way people deal with medical costs has become significantly more expensive in the last several years. It's been a common request from realtors and affiliate members alike. Is there anything that can be done to deal with healthcare costs that are a little more affordable? So this solution that we're going to talk about is significant from a cost savings perspective. So if you look at these, there's a few different examples that we chose. I'll show you a whole grid next of all the different costs for families, for individuals, for couples. But we picked three just as examples, just to show you here the cost savings. Individuals age 35, the cost savings for something fairly similar is a 48%, family of four, where the parents are age 45, 62% savings, and then a couple age 55 is about a 70% savings. So that was one of the main reasons that we worked on this with CARS, to provide some sort of cost savings among the other benefits that we'll talk about as well. But that was a big driver, was the cost savings. So here is the cost chart. You may have seen one of these before. We distribute these to all the local association executives, and a lot of realty offices have these. We can get PDFs of these out to anybody. It's a pretty simple thing to do. But if you look here, the age band is broken into groups of 10 years. So between 18 and 29, 30 and 39, 40 and 49. So if you just find the age of the oldest couple in a family, if you're talking about two adults. So a member only, clearly there's only one adult. But member only doesn't mean realtor, by the way, necessarily. It means member of this solution. So it would be enrolled in these different programs. We've built technology to consolidate the enrollment into one enrollment process that enrolls you in these benefits, and these are the costs for all of that. But the member would be the enrollee, not necessarily the realtor, or not the member of the local board. So sometimes that causes confusion, and I want to make that clear. So if you've got let's say you've got a realtor age 43, and you're looking for costs here, and it's just the realtor, one individual is joining this plan, it would be one of these three costs, depending on which IUA option you choose. We'll go into more detail about what that means, but that's essentially the amount that the member pays out of pocket on a per medical need or incident basis before the community provides funds for this. We'll get into more detail about what that means, but you can think of this along similar lines as a deductible. So if I'm in a skiing accident on the mountain there in Vail, and I have 11 different medical bills that add up to $28,000, my out-of-pocket expense would be $500, and the rest would be provided by the pool. Okay, that would be if I chose the $500 IUA. If I'd rather pay $2,500 out of pocket, then my monthly cost would go down. So this is one adult. Member and spouse would be two adults. Member and children would be one adult and children. And then member and family would be two adults and children. And it doesn't matter how many children are on the plan. We've had several people join since I started, so I want to throw this out there as well, that if you have questions, use the chat feature in Zoom. I keep that box open in a screen to my right, and I keep an eye on those to try to answer questions. But I mute people on the webinars because the background noise becomes a large distraction when we do these webinars. And then one last thing I'll point out on this, or two things that I'll mention on this slide, is that for tobacco users, there's a $76.53 surcharge, and that just helps offset the increased risk that using tobacco creates. And then lastly, the costs that you see here, once you find the cost that makes sense for you and or your family, that cost represents all the benefits that we're going to be talking about. It isn't a cafeteria style, hey, I'd like this benefit, but not this one. I'll take this one and this one, but not this one. All of these costs include all of these benefits, okay? All right, let's talk about this solution real quickly. We're going to do a summary, and then we're going to go into each of these benefits in detail. I think about, excuse me, I think about these four on the right as sort of your day-to-day medical care benefits. Sedera is there for the whoppers, right? You need a surgery or some kind of expensive procedure or some kind of process for a diagnosis, if you've got to go through radiation for cancer or something like that, and the costs are very expensive, that's where this gets involved. But these four benefits on the right are for your day-to-day medical needs. You need to talk to a doctor, you need a medication, those sorts of things. So if you look on the bottom right-hand corner of each of these boxes, it describes what medical need these different components are designed to address. So Sedera is for the medium to large medical expenses. Apex is for the in-person routine and small medical expenses. So think about, x-rays, urgent care, talking to a doctor because you're feeling sick, going into the doctor's office, that kind of a thing. Teledoc is telemedicine for virtual care. This is a very cool benefit that we'll talk more about in more detail. But this is talking to a doctor either through a secure video conference or on the telephone, your choice, to take care of things that can be done that way. So think of things like sinus infections, ear infections, stomach pain. If you want to talk to a doctor but you don't want to go in and visit, you don't want to make an appointment, you can use Teledoc, and you have unlimited access to Teledoc 24/7. They're open every hour of every day of every year, and it doesn't cost extra to use them. Welldyne RX is for prescriptions. It takes the cost of prescriptions way down. And then Second MD is a second opinion service when you have non-emergency procedures scheduled. So we'll go into detail about these things. The first one I'm going to talk about is Apex. So Apex is for the routine and preventive services. So there's a category of services that are considered preventative, and the list of all of those things is available on the healthcare.gov website, which you see here. And it lists all of the things that you can get addressed by a doctor for free. Because Apex is a part of this solution, it covers all of the preventative benefits that are listed here on this healthcare.gov website. It's a bunch of them. Then if you need to go see a primary care, so let's say you're not feeling well, you think your sinuses are backed up, you've got a cough, it's not going away, whatever. There's a $20 copay to go see a doctor. Specialists have a $50 copay, urgent care has a $50 copay, lab and imaging has a $50 copay, and then MRIs and CT scans have a $200 copay. Okay. There is a max of how many times you can use that copay. Don't misunderstand that's how many times you can go see a doctor. That's not true. You can see a doctor as many times as you need to. But to use a $20 copay to see a primary care physician, there are 3 visits per year where that $20 copay would apply. It just made sense to have that limit. That was an option, and it made sense to put that on there because most people don't see doctors this often, and it lowered the monthly cost very significantly. So we thought it made sense in this program to use that feature. Okay, if you have questions about that, again, I'll remind you, use the chat feature in Zoom, and I'll address questions as we go. Okay, next, let's talk about Sedera. Within Sedera, we're going to be talking about Teladoc and 2nd.MD. I don't go much into the Welldyne, which is the prescription benefits, because it's simply just a very efficient cost reduction for prescriptions. So I'll be going through a story of when I used Teladoc several months ago. Went to the pharmacy and picked up 2 prescriptions that the Teladoc doctor prescribed for me, and cost me $2, $1 for each. I also got an inhaler several months ago, and that was like $20. Those retail for about $85. So Welldyne, there's not a lot of details to it. If you have a specific prescription that you'd like to know more about, contact us, and we can look that particular one up if you're worried about a particular cost, or if you're on a medication that you need to stay on and you'd like to know what it costs, we can help you look that up and get an exact cost. So, okay, so let's talk about Sedera, and within Sedera, we'll be talking about 2nd.MD and Teladoc. So Sedera is a medical cost sharing solution. It is not traditional insurance. There are some advantages and disadvantages to that, and we'll talk about that. But it's a much more transparent and efficient way of dealing with medical costs. And and we'll talk about the why and how they do that, and what the disadvantages are to that as well as we go. So really quickly, there's a couple of points I like to point out. Before we go into this, I'll remind everybody, CAR is not affiliated with Sedera. I am not affiliated with Sedera. We worked with CAR as an independent broker for putting this option together. And I don't think medical cost sharing is the right solution for everyone. We are working on some insurance-based solutions. Those insurance-based solutions will necessarily be more expensive. We'll talk about why that is in a minute. But CAR's position on this was, hey, if we have something that's going to be useful for some realtors, let's make things available as we are able to do them. And then as we work out some insurance-based solutions, we'll make those available as well. So medical cost sharing works a little differently than traditional insurance. And I'll go through a couple of points here. First is that you interact with your medical providers as a cash pay patient. This makes things much more streamlined, much more transparent. The Sedera community pool of money doesn't belong to Sedera. It belongs to the community. Sedera takes it's about a 10%. It's like 9.9% of the monthly cost that goes in to pay for your Sedera membership. 9.9, I'm just going to call it 10%, goes to Sedera to administer this and to have to play the role that they play. But the rest of the money belongs to the community. So there's no incentive for Sedera to not pay for medical costs, for them to not release funds, the community funds, to pay for medical costs. It's about people over profits and numbers. It's a model that's been proven for over 30 years. It's not a new model of dealing with healthcare costs, by the way. There's no networks with Sedera. Again, you deal with your medical care providers as a cash pay patient, so there's no networks. One thing that Sedera tries to remind everyone of, there's no panel telling you can or can't get certain medical procedures, but they do try to instill a commitment to a healthy lifestyle, because I think we can all agree the best way to lower medical costs, the single best way to lower medical costs, is for us to strive to live healthy lives, right? To not need medical procedures. And then when we need them, let's figure out a way to pay for them. That's what Sedera is. But if we can all commit to do our best to live a healthy lifestyle, that will help bring the cost for all of us down. And we all belong to this community when we enroll. And then how money is shared. So I'm going to use that word a lot, shared. They call it, when money is sent from the community to a member to pay medical costs, they call that sharing. So that sometimes people think that when the community is sharing, that they pay some and I pay some. When I say sharing, what I mean is community funds are sent to the member to pay medical expenses. Okay, so let's talk about how this works. We're going to talk about how things are shared. This is a major difference between this and traditional insurance. Oh, I forgot about this slide really quickly. Just sometimes medical cost sharing is a new idea to people. I find this to be less true up in the mountain communities because you guys, I mean, healthcare costs more money up in Vail. In fact, I think I heard a statistic. Well, I know I heard a statistic. I think it was a couple of weeks ago is all, that Vail has the highest cost of medical care, not in the state, but in the country. Like the entire United States, Vail is the most expensive. So in the mountain communities, people have looked into medical cost sharing. They're a lot more familiar with it. That may not be true of everybody listening. However, people in the mountain communities have been looking for ways to save on medical costs more aggressively than people in the Denver metro area or people in Montgomery, Alabama, or whatever, because it's just so expensive to get it. So this is not a new idea. Medical cost sharing is a very quickly growing trend in the country, over $1 billion. And this is as of 2017. So, I mean, these are pretty old statistics. Over $1 billion shared, spent by medical cost sharing communities for medical expenses for their members. And this trajectory is getting even steeper now. And then there are over 1 million members nationwide using medical cost sharing as a solution for medical costs. So anyway, that's just to help remind you that this isn't a new idea. The idea has been around for over 30 years, and it's a fast-growing trend in the country to deal with medical costs. Okay, this is what I promised we'd be talking about: is what needs mean in the Sedera community. So they share funds or pay medical expenses on a need basis. What that means, the definition for that is one or more medical expenses caused by a single accident or illness. So let's go through an example of me skiing in Vail. I fall and break my leg, and it's a bad one. I take a ride in the ambulance. I go to the hospital. There's all sorts of bills from the hospital. I have imaging. I have recovery. I have follow-up visits and physical therapy. That broken leg might cost me, $30,000 between all the bills that add up when that incident happens. Before I move on in this example, I'll remind you, it doesn't have to be an accident. It could also be a diagnosis. So if I'm not feeling well and I go to my doctor and the doctor comes back with some tests and says, I got some bad news, we're going to fight cancer together. That could just as well be a need. It doesn't have to be a skiing accident or some kind of physical accident. It could be a diagnosis. So all the bills that add up related to that need get grouped together. I would be responsible for my IUA, and I myself am on the $500 IUA plan. So this is a program or a solution that we built that we're happy with. I use it myself. I'm an affiliate with CAR, and we like it so much in my family that we use it. This isn't U.S. Congress. We actually built something that we think works in our homes as well. So if I'm skiing in Vail and I crash and I break something, I've got all these bills that add up. Let's say they add up to $30,000. I would be responsible for $500, and then the community would provide the $29,500 difference to pay medical bills. Okay. And then within the Sedera guidelines, I'm only responsible for 3 IUAs per year. If I have a 4th accident, if I'm particularly clumsy or particularly sickly and have 4 unrelated accidents, I say unrelated because if they're related, then it's the same need, right? If I have a complication medically and it trickles or spirals into a few different complications, that would all be considered one need because it's one diagnosis. But let's say I crash skiing, I also get diagnosed with something. As soon as I'm done recovering from my skiing accident, I crash on my mountain bike, and then I also get diagnosed with something terrible later that year. That would be 4 IUAs in one need, or in 1 year. I would be 4 needs in 1 year. I would only be responsible for the first 3 IUAs. The 4th need, my IUA would be considered 0. I would not be required to pay the $500. All of my medical expenses would be paid at that point for the 4th need. Okay. All right, this is just, let's see, did I miss anything here? Okay, this is just a nice testimonial about, Sedera has bunches of testimonials on their webpage, but this is one that I just particularly like. I have some people joining this webinar just on the phone, so I'm gonna read it out loud, but it says, my first experience utilizing the Sedera community came when I had an emergency C-section with my 2nd son, and then he spent 10 days in the NICU. And throughout the sharing of our need, I saw how the community works through a compassionate team at Sedera. I was completely shocked at how easy it was and how much I liked being a part of the process. This was so significant. I asked Sedera if I could come work for them. And Juliet's been working for them since I think it was late 2016. She's been using Sedera since 2016, and since late 2016 she's been working with them. So great lady. Anyway, I just thought that's kind of an interesting testimonial. So let's talk about where this doesn't work. Okay, I would say the main dial that determines whether this is or isn't a good fit for you and your family would be how Sedera deals with pre-existing conditions. Okay, so if I crashed on my mountain bike this summer and I was hoping it would go away, but it's not going away, it seems to be getting worse, and I think I'm going to need surgery, I cannot join Sedera and get surgery on that shoulder in the first year because it was a pre-existing condition. Now, if I join Sedera and my very first day as a member of Sedera, I crash on my mountain bike and hurt my shoulder, that's a legitimate need. I can use Sedera benefits for that need. But if it was a pre-existing condition, they don't write checks for procedures or for medical expenses related to pre-existing conditions in the first 12 months. That just keeps, I think we can all understand why they need to do that. It just keeps people from not using or not paying for anything until they're hurt. And then they go in and join the community, use $30,000 and then leave. That is not financially sustainable. This has to work for everybody. So that's how they deal with pre-existing conditions. In the first year, they don't share money for pre-existing conditions or for medical expenses due to pre-existing conditions. Now, a pre-existing condition is defined as a condition for which you've had symptoms or treatment in the last 36 months. So if I broke my arm 5 years ago, got better, that would not be a pre-existing condition. If something flared up because of that arm and I haven't had symptoms or treatment in the last 36 months, that would be eligible for sharing. I wouldn't need, that would not be restricted because it was a pre-existing condition because it was 5 years old. We've had people that are cancer survivors join the program. They've been in remission for the last 36 months or longer, and Sedera brings them on and doesn't consider that cancer as a pre-existing condition because they haven't had symptoms or treatment in the last 36 months. So in year 1, there's no sharing. In year 2, so months 12 through 23, there's a $15,000 limit on pre-existing conditions. So let's go back to that shoulder example. If I wanted to get a shoulder surgery in my 13th month of membership, my limit on that would be $15,000 that Sedera would write checks for. So if that cost would be under $15,000, I'm great. If it's over $15,000, I'd either have to wait or come up with the difference myself. Year 3 has a $30,000 limit, and then after 3 years, pre-existing conditions don't matter with Sedera. Once you've been a member for 3 years, even if it was a pre-existing condition, if it's something that needs medical attention, there are no restrictions on that. So when it comes to pre-existing conditions, there are some exceptions, by the way. So if you have any of these issues, so high blood pressure, high cholesterol, sleep apnea, or non-insulin dependent diabetes, but it's well controlled, I mean, you haven't been hospitalized, there haven't been medical bills in the last 36 months for these things, just the prescriptions and just, regular doctor visit to check up on them. If they're well controlled, they are not considered pre-existing conditions. So to make this clear, if I have high blood pressure and or high cholesterol, but it's well controlled, but within my first 12 months of membership with Sedera, I have a heart attack, that's a shareable medical expense. The heart attack is, even though I had high blood pressure and high cholesterol when I joined Sedera, because those things were well controlled, and they're not going to exclude me from having the community money spent for my medical expenses. Okay. We're going to talk a little bit later about some of the benefits that Sedera offers that aren't money. So like their service and how they help you find medical care providers if you need help looking for them or help negotiating things. And I'll mention while we're on this page that even in the first year, all the member services that Sedera provides, so if you'd like their help negotiating bills or shopping, so let's say you do need a shoulder surgery and you're going to have to pay for it, this is your best option regardless of the fact that it was a pre-existing condition. They will help you shop and find a surgeon that will do it for the least cost. They'll help you negotiate those things down. All the member services are available whether it's a pre-existing condition or not. So I'll throw that out there. That doesn't mean if you have a pre-existing condition that they won't talk to you about it and help you through the process. They just won't write checks for medical expenses in the first year for pre-existing conditions. Okay, we've had a few other people join since I started, so I want to remind people, if you have questions, I try to answer them real time. Just throw them up there on the chat feature of Zoom. Okay, so we talked about Apex, we talked about Sedera, we talked a little bit about Welldyne RX. I don't use slides on that because it's just a pretty simple, it's the program that brings the cost of prescriptions way, way down. But I'm going to talk about Teladoc and 2nd.MD next. Oh, okay. Sorry, I shuffled the slides up a little bit differently than I did last time. So let's talk about Teladoc and 2nd.MD here. So Teladoc, the best way for me to illustrate how this works is just with a personal story. So I had a sinus infection a few months ago, and I usually try to let those run their course, and it wasn't, and I needed to get back to the 100% Brady. And I finally decided to address it with the doctor. So I remember doing this late at night, about 10:30 or 11 o'clock at night. I'd put the kids to bed. I was ready to deal with it. And as soon as you enroll in this overall solution that CAR is providing, you get a profile with Sedera, Apex, Teladoc, Welldyne. 2nd.MD is a part of, it's not a part of Sedera, but it's included with Sedera. They're a third party. We'll talk about that next. But as soon as you enroll in this program through the CAR portal, you get all of these benefits right away. And the Teladoc benefit, basically what I did is I pushed the app on my phone. You can also do it on your computer. I pushed the app on my phone, and within about 3 or 4 minutes, I was talking to a doctor through a secure screen conference or a video conference. She starts asking me questions about how long I've had the symptoms. Am I having trouble sleeping? Am I coughing? What's going on? And we talked for about 10 or 15 minutes. She prescribes me an antibiotic and a prescription strength cough suppressant, asks me which pharmacy I'd like it sent to, and I send it to a 24-hour one near my home because it's, it doesn't matter, I guess, but I have her send it to a Walgreens near my home. She sends the prescription there, and I get dressed up in my warm clothes and head out and go get the prescription. And within about 45 minutes of me pressing that app on my phone, I'm taking antibiotics and a cough suppressant and going to bed. And I spent $2 that night, $1 on each of the prescriptions. I never paid a copay. I never paid any co-insurance. I never set an appointment. I didn't have to look at places that were open where I could go see. I didn't have to sit next to 6 or 7 other people who were sick in a waiting room, all of us exposing one another to each other's maladies. I just did it all through my phone and took care of it in about 45 minutes at 10:30 or 11 o'clock at night. It's fantastic. That's always, for minor things, that's always my first approach because it's so simple. Certain things they can't do. They obviously can't touch you over the phone. So if they need to diagnose something that requires touch, you'll need to use the Apex benefits and go into a facility. They can't prescribe narcotics. The FDA doesn't allow that through the telephone. And that's about it. I mean, it's open 24/7, 365. If you need attention on Christmas Eve or New Year's morning or whatever, they have doctors ready to talk to you to take care of medical things. They can diagnose and prescribe things over the phone. It's awesome. And then really quickly, 2nd.MD is a second opinion service. This is something that is here for non-emergency procedures. So let's say you're thinking about getting a knee replacement, your doctor has prescribed it. 2nd.MD will collect medical records and give you a second opinion for free about that procedure coming up. This is important because, first of all, we live in an environment where the medical field is evolving so quickly and doctors are so busy that they get behind on the latest technology very quickly. A recent study showed that specialist doctors are behind their field by an average of 17 years, and that's an average. So that doesn't mean that doctors are lazy or that they're not staying up to date. It just means that they're busy and the technology is progressing very, very quickly. So 2nd.MD is a third party. They're not affiliated with any of these other groups, but they are a collection of the nation's top doctors in their specialties, and they review your records and give you a second opinion about what it is. Nobody is requiring you to use that second opinion, by the way. So if you've got a knee replacement scheduled, second MD comes back and says, hey, this, based on what we see here, we'd probably recommend doing this instead. It's less invasive, it's less expensive, it's a faster recovery, et cetera, et cetera. You can read that report and decide to go through with your knee replacement surgery that you had scheduled in advance. Nobody's requiring you to use the advice of second MD, but Sedera does highly incentivize you to use second MD. Like, hey, if you've got something scheduled, get a second opinion from second MD, and maybe it concurs with your opinion of your previous doctor, or maybe they give you something else to think about, but they want you to at least see it to make sure that first of all, that you're getting the best care that you need, because not only is it important to get good care, but it's also important to not have to go back, right? We want it to be effective. We want it to have as high a success rate as possible. But it's also important if we want to talk nuts and bolts, it's important for the community to make sure, as far as from a financial concern is concerned, we want to make sure that whatever treatment that members need solves the problem, so that there's not this recurring medical cost for something that could have been fixed if only a newer technology or a newer procedure worked better, right? So we want people to get the surgeries, the medical attention they need, and be back to their normal selves as quickly as possible. So Second MD exists to get second opinion services, again, on non-emergency situations. If you've got an emergency, of course, everything's different. You go get the care that you need, and then we retroactively put these pieces together to pay those bills, because emergencies are emergencies. Okay, let's go through a couple of examples. This is an example of a sinus infection. This is not using Teladoc, by the way. This is just a sinus infection where you go to see the doctor. There's a $20 copay because of the Apex benefits. There's $1 for the prescription. It's a generic, in this case, it's a generic antibiotic, and you're out of pocket $21 to take care of the sinus infection, either for you or somebody in your family. Pretty straightforward. Had you used Teladoc, then this $20 would go away and you'd only be out of pocket $1. Okay, pretty straightforward. And this was all solved using these two benefits, Apex and Welldyne. Here's another one that was solved using Apex and Welldyne. You go to the doctor, let's say you're playing or you're skiing and you hurt your ankle, you go to the urgent care, x-rays determine that it's not a break, it's just a sprain. The x-rays, there's a $50 copay for that. You're out of pocket $51. The $1 here was for a low-cost generic painkiller, say. We didn't need any money from the Sedera community in either of these circumstances, because we didn't rack up enough medical bills to even pay for the IUA, right? If my IUA in all these examples is $500, then if the bills don't add up to $500 or more, I don't care about Sedera's benefits. I don't need them, because I'd be out of pocket $500 for a need anyway. So let's throw a little curveball in this example. Let's say this sprained ankle isn't a sprained ankle, it's a broken ankle. I go get this x-ray and the doctor comes in and says, hey, I got bad news. There's a couple breaks here and it's not going to heal on its own. We need to intervene, cut it up, put it together, put some of the what do you call it, pins in it or whatever. So if you get let's say this x-ray comes back with something a little more complicated, and now all of a sudden, instead of being out of pocket $101, we think, okay, this is going to be more expensive. There's going to be surgery, et cetera. We need to get Sedera involved. This $101 that I have spent so far counts toward my IUA. So if I go to Sedera and say, hey, I've broken an ankle, I've gone to the doctor already, there's going to be a procedure, I've already spent $101, they will count that towards your IUA. So you'd only be responsible for another $399 before the community would provide funds for the rest. Okay. I'm going to skip pregnancy real quick and go straight to heart attack. So heart attack's clearly way more expensive than any of these other examples we've done so far. Let's say the hospital bills add up to $54,000, the anesthesia and surgery are $22,000, the prescriptions are $425, and then follow-up visits are $500. So if all those costs add up to $77,525, I'd be responsible for $500. The Sedera community would provide $77,025 for the remaining bills. Pretty straightforward. Pregnancy is a little different, simply because pregnancy, in this example, we're talking about an intended pregnancy where a couple is adding a child to their family, right? So those other examples we won't go through today, but if it's the product of a crime or something like that, that would be a traditional medical need, and it would be dealt with not as a pregnancy, but as a medical need a little differently. So, but if, let's say we're talking about a typical pregnancy, the IUA, no matter which program you choose, the IUA is always $5,000 for a pregnancy. Anything above and beyond that, the community will share. There is a timing issue involved with pregnancy. So they deal with pregnancy. So pregnancy can't be a pre-existing condition. You can't join the community already being pregnant and use community money for that pregnancy. In fact, you can't, well, their timing on is a little different than traditional pre-existing conditions. What matters here is the due date of the baby. If the due date of the baby is after 12 months of your initial enrollment date, then this IUA applies, and the Sedera community will help provide for that family's addition. Okay. If the due date of the baby is 11 months or 10 months after joining Sedera, then they don't provide funds for a pregnancy. So you can't join the Sedera community and get pregnant the following month and use the community money for that pregnancy. The due date of the baby must be 12 months after your initial enrollment date. Okay. If the baby is born prematurely, then that isn't significant. Sedera will still provide funds for that pregnancy as long as the due date is after 12 months of your enrollment date. Okay. All right, here's one more view of the pricing. Again, it goes by ages. We now, I think, understand what IUAs are. You have 3 different choices on what you want your IUA to be. I myself am in my 40s, so I'm on the $500 IUA option. So if I was just doing it for myself, it would be $364. If it was me and a spouse, it would be $647. Me and my children would be $617, and then me and my spouse and my children would be $911, $912 per month. So that's how that works. I think that's pretty straightforward. And again, these prices include all the benefits that we talked about. There's a $76.53 surcharge for tobacco users. And I think that pretty much covers everything on that page. Okay, here's how to enroll. I'm going to go back here before I roll that out. I emphasize here that you don't apply. This isn't something where you send in medical records, you hope they approve you, you hope they accept you. It doesn't work that way. Everybody who enrolls is accepted. There's no application process where you're accepted or denied, okay? You can go to the Colorado Realtors website. I'll bring that up here. Oh, okay, that's this. This is CAR's website. If you go to members and then realtor benefits, then you'll see this affordable healthcare option right here is where you go to get to the landing page to enroll. Or you can just go directly to this landing page, which is oneenrollment.com/Colorado Realtors. I'll bring that up. Okay. So here's how you go through the CAR website, or you can go to oneenrollment.com/Colorado Realtors. It'll take you to the same place. Okay. I'm finished. I'll leave this up for a little bit longer in case people are writing things down. I'll bring up my contact information next, or rather our contact information, so that you can contact us with questions if you have them. If you have questions now, you can throw them up on the chat feature of Zoom. And here is our contact information. So if you're anything like me, you don't like sending emails to an email address that starts with info. I don't either, but I can guarantee you that is being looked at all day, and we respond to those very quickly. So if you have a question and you'd like to resolve it through email, you can email us at info@alpineassociationbenefits.com, or you can call us 720-523-5524. And again, this is the same website that was on the previous page. oneenrollment.com/Colorado Realtors is where you can learn more about the options here. Now, if you would like my contact information, that's next. I would encourage you, if you have questions about enrolling or about how the program works, this is the best contact information. I spend most of my time doing presentations about it and traveling around the state and talking to people. So I'm more than willing and happy to help everybody. I'm just a little less available than people at the office whose job it is to answer questions and field those calls. So this would be the best source for that kind of thing. But if you're a part of an office and you'd like me to do a webinar for your office or visit the office and answer questions, that would be probably the best reason to contact me directly. And here's my contact information. That's my name, Brady.Mullen at alpineassociationbenefits.com. And then that number is my cell number, 720-285-8050. Okay, I'm finished. If you have questions, please contact us. I will be sending a recording of this webinar to you, Erica. And if you want to distribute that out, or if people ask about it, that's where it'll be. I appreciate everybody joining. I'm going to stop the recording now, and I will keep this webinar going for a little longer to answer questions if people have them. I'll keep an eye on this the Zoom chat feature. And thank you all for joining.